if you want me to look, I can also demonstrate on this as well. If you want to look at all the boy portions. So we look at the boy here. Ladies and gentlemen, epididymis. This is epididymis. This is epididymis. So this is epididymis. Next is spermatic cord. This is spermatic cord. Now, if you think a guy has hernia, what do you see? What do? You hold his both spermatic cords with your thumb and index finger. Your hand should be gloved. You understand that? And then you need to ask them to turn his mouth like this and open it and cough. And what you feel for is loops of intestines. If you can feel loops of intestines, he has indirect inguinal hernia. And he needs surgery. And you will not select him for any combat-based, activity. He cannot be in the military, he cannot be in the Navy or Air Force, he cannot be in law enforcement, because if he'll run after somebody, then he can actually, that hernia can become bad. But this is what is called spermatic cord. Okay? So this is spermatic cord. Then vas deferens. These are vas deferens. So you see, these are vas deferens. They are present in the spermatic cord, but we could not see them because this is the pampiniform plexus of veins. There is artery to the vas. There is the internal and external spermatic fascia. There is the cremaster. And then, there is the processus vaginalis, which is found in the spermatic cord. So there are quite a few layers of the spermatic cord. But actually, vas deferens had started where? They had started at the epididymis. But here we can see all that very clearly because it has shed all those coverings. These coverings come as vas deferens pierces through the inguinal canal. So this is the vas deferens. Okay? And here it is going, and here it is going to get contribution from the seminal vesicles. So after the vas deferens, we have seminal vesicles. These are the seminal vesicles here, which are contributing up to 80% to the semen. Okay? And then next is ejaculatory duct. For ejaculatory duct, we need to open this thing up here. Yes, excellent. So you see here that as soon as the vas deferens will enter into the prostate, you will see this small portion of the ejaculatory duct. In that other model that we saw, it was demonstrated much better. You see here? In this other model, you could see it clearly going through and through. In this one, you see a very small extent of it. Okay? So ideally in the exam, we will use this model if we have to ask you about the ejaculatory duct here. Okay? Is that all right, ladies and gentlemen? Okay. Next is prostate gland. So prostate gland is this one. You see here? Walnut shaped, sitting just under the urinary bladder. This is the prostate gland. Okay, so this is the prostate. And then you have the portions of the penis, which, again, this is the glands. And this is the corpus spongiosum. You see how many gaps are there? So it looks like a sponge. And this is corpus cavernosum. So this completes and concludes the male reproductive system, ladies and gentlemen. Now,